Hello, everyone. Welcome to our webinar tonight. Thanks for joining us. Appreciate everyone joining us on this beautiful spring evening. I think we're going to go ahead and get started. Welcome and thanks again. I'm Laura Ellsworth, Strategic Partnerships Manager and Advocacy Manager with Council for the Homeless. My pronouns are she, her, hers. And tonight we're here to talk about the Homeless Crisis Response System data and the key takeaways from 2020, which is, as we all know, a year like no other. So just a bit of quick housekeeping as usual before we get started. The only people that you see in here tonight are the panelists, so relax, enjoy a nice beverage or snack, cuddle up with a pet or a kid, and enjoy you're not on camera. We're going to have some time for some questions and answers later, so please do post questions in the Q&A section in order to keep questions from becoming lost in the chat box, which tends to happen as more messages get posted and the scroll moves really quickly. We have disabled the chat function just for attendees so that all questions can be placed into Q&A. But we might post some information in the chat. The panelists might do that. And so please do keep an eye on that space for any useful information as we go through our webinar tonight. And then also we're going to be recording this webinar and we'll post it on our website and send it out within the next week. So here's a look at our agenda for tonight. Dale Whitley, HMIS Administrator, and Kate Budd, Executive Director for Council for the Homeless, will review the data and share some key takeaways from 2020. We're going to hear from some of our local service providers about the past year and how their experience kind of goes with the data that we're going to be sharing tonight. And we're going to have some time for questions and answers with our panelists. And as always, we will end this webinar with our calls to action. So please do stay tuned for that. So Dale, I'm going to go ahead and turn it over to you. And I can advance the screen for you if that's helpful.
Hi, I'm Dale Whitley, HMIS Administrator with the Council for the Homeless. And HMIS stands for the Homeless Management Information System. Any continuum of care, COC, like ours that receives funding from HUD is required to enter their client data into an HMIS system. So yeah, our continuum of care covers all of Clark County. So the information that we have is for our entire COC. And it's a secure system. So everybody that has access to the system has to sign client confidentiality agreements. And we have a security certificate that's installed on anyone's computer that's going to be accessing the system, so that only those computers that we've installed that certificate on can access the system itself. So we take clients' privacy and information, very seriously. So as far as the providers that go into add their data to the system, it's all year-round emergency shelters and our seasonal emergency shelters and transitional housing programs, as well as rapid rehousing programs, diversion programs, and homeless prevention programs. So for people that aren't homeless yet or are at risk, those programs enter their data as well. And outreach teams, so those agencies that have teams that go out into the streets and into encampments and enter client data, their data gets entered into the HMI system as well. And then we also have services only programs. So there's programs that have drop-in centers where clients can come and get services. They record that information, and some such as the giving closet. So like a kind of like a a thrift store, or or clothing, where they distribute clothing or food. Some of those programs enter their client data into HMIS as well. So you can see, we have a wide variety of different programs that enter their data. So it's a great benefit to have all those included. So as well, and also the Housing Solution Center. So that is our call center for anyone who's seeking shelter or housing assistance. They call the Housing Solution Center to get screened to see if they qualify to be placed into one of the programs. So that casts a very wide net that we're able to collect all this data from every year to be able to produce annual reports. One of the benefits of having this coordinated entry system is that we're able to coordinate the care across these programs. So gone are the days where somebody used to have to go through a list and call each agency one at a time to see if there was any openings. Now they can just be screened and referred and placed into a program. So it can be all within this one system. So, they could get screened by the Housing Solutions Center, placed into a program. We can create a referral within the system where when they arrive at that program, their information will already be there. Like if you check into a hotel and they already have your information in the computer ready to check you in. So that's one of the benefits of having this coordinated care system. And another one is that we're able to produce these system-wide reports where we can see how clients move through different programs, as they're screened or as they're placed into a program, or hopefully exit to home to house status. So one of the elements that we have to define related to clients in the system are homelessness. So we use HUD's definition, because we're reporting to HUD, of literal homelessness. So this is clients who are in their car, on the streets, or in a shelter are experiencing homelessness. And then there's also clients that are counted that are at risk of homelessness. So those are ones that might be doubled up or staying with family or friends, or perilously housed. Maybe they're behind in their rent and are very close to becoming homeless. And so, yeah, that's a summary of our HMIS system and how the data is collected, and the different groups that report it that you'll see included in the information coming up.
Awesome, thank you, Dale. All right, I'm gonna now turn it over to Kate Budd, our Executive Director. And Kate is gonna share with us some of the actual system data that we have to report on. So Kate, go ahead and take it away. I'll stop sharing my screen so that you can start sharing yours.
You can go ahead and go back to sharing yours.
Okay.
So Dale, thanks so much for that quick summary. It's always interesting to hear the breadth of providers that enter into the HMIS system. That's one of the reasons that when we share our system numbers, we're feeling like we've captured the majority of people who are unhoused in our community, because we know that most people interact with some aspect of our homeless crisis response system, whether it is shelter or a outreach staff member or a winter shelter or some other type of program. So I wanted to start off by asking the attendees, how many people self-identified as experiencing homelessness in Clark County throughout 2020? And I know that unfortunately you can't pop up the chat and give the answer, but I do hope that you'll go side to side to the people that you're with and make a guess, if anything. What I often hear from people is when they're asked this question, they share, maybe 1,000, maybe 300. And in 2020, the reality was that our system interacted with 6,359 people, which the reaction I get from people is that it's much higher than what was anticipated. And often it's because we don't see that many people in our community. Also because this encompasses a full year's worth of time. And so it doesn't mean that on one night there was a total of 6,400 people experiencing homelessness. It means that across the full year, that was the number of people that identified as experiencing homelessness. Thanks to Laura, who activated the chat. So for the next one, you can actually put your answer up if you'd like. Next slide. So this is a breakdown a little further of those 6,400 people that were experiencing homelessness by age. A couple things that I want to call out here is that there were nearly 1,700 children that were encompassed in the total number of people that are experiencing homelessness in our community. That's really important for folks to know and to be aware of, in that we have a rather significant number of children under the age of 18 who are experiencing homelessness, who, if you can imagine, were going to school, if it was even possible, from a car or from a shelter or from the streets or a home that wasn't actually meant to be a home. And that's something that I hope our community will continue to collectively help to address. Another number that is certainly notable from this chart are the number of seniors. So folks who are aged 55 and older. Nearly 900 seniors were experiencing homelessness in 2020. And that's actually a little lower by 20 individuals than 2019, which was closer to 900 seniors that were experiencing homelessness. And so in Clark County, we're seeing a very large number of seniors fall out of housing and into homelessness. And what we hear time and time again, and our panelists, please feel free to share when you're up if you have these experiences, but that seniors are getting priced out of housing, that they may just have Social Security, they may have some pension dollars, but regardless, it tends to be fixed. And when their rent goes up, even by $50 or $100, their fixed income doesn't increase at that rate. And so then they end up having to leave their home. They may stay with family or friends for a while, but once they run out of their social network and aren't able to continue to stay with folks that they know, then they often fall into homelessness. Next slide. So this is another way of looking at those 6,400 individuals, this time by households. And this shows you the identifying household type that someone shared when they called in for assistance. So for example, throughout 2020, there were a little over 1,000 single women who called in that shared they were on their own and didn't have a partner and didn't have kids. And I think that this is helpful information to know when we're thinking through what type of additional supports are needed in our community. Right now, we have the largest number of beds for single men within our shelters. And proportionately, we don't have as many for single women. That's why I'm thrilled that Bertha's Place, the new shelter that's going into the Howard Johnsons, is going to serve single women as well as couples. Because in fact, right now in our residential shelters, there are no spaces for couples. And so this is going to make a big difference for those who choose not to leave their partners. Next slide. So another quiz for you. What percentage of people experiencing homelessness were new to homelessness in 2020? And what this means for us is that they hadn't touched our system within the previous 2 years. So feel free if you want to put it in the chat or just think of the answer in your mind. Believe it or not, the answer is 65%. So over nearly 2/3 of the folks that identified as experiencing homelessness in our community were new to homelessness. And what's even more interesting is that if we go back and we look at the 2019 numbers, very similar percentage of new people who are experiencing homelessness. And so what that says to us is that we are moving people out of homelessness. Not everyone, certainly. In fact, over a third were not new to homelessness, but we moved significant number of people out of homelessness. And for those that were moving out of homelessness, we're seeing more people fall into homelessness. And that also makes sense, not only because people continue to have life experiences that may lead to homelessness, but we also know that our rents kept going up between 2019 and 2020. And so we continued to hear stories of people who, even had been doubled up or couch surfing with someone, but no longer could do that because of COVID. And so they fell into homelessness, or maybe they felt like the situation was no longer safe where they were because of COVID, and that homelessness was actually a safer situation for them. And those were realities as a result of COVID that we heard about throughout last year. Next slide. So here's just a graphic of that information. Again, about 2/3 of folks were new to homelessness that were identified throughout 2020. So another quiz question for you. What percentage of folks experiencing homelessness identified as BIPOC? Give you a second to think through that. And the answer is B. Thanks, Jennifer, for putting your ideas in there. B, yep. And so with that, a little over a third of people experiencing homelessness in our community identified as Black, Indigenous, or a person of color. Next slide. And that makes sense. We see that the disproportionately our BIPOC community experiences homelessness and the harm and trauma of it much more often than those who are white. This chart shows the likelihood of experiencing homelessness. So for the general population, all of us included, the likelihood of experiencing homelessness is 1.4%, so very low. Then if you start to look at each particular race or ethnic group, you start to see those that are BIPOC, with the exception of those who identify as Asian, have a much higher likelihood of experiencing homelessness. You can particularly see those who are Black or Pacific Islander have an extraordinarily high at 8.7 and 8.6% likelihood of experiencing homelessness. And so with that, knowing that our Black and Pacific Islander neighbors are more likely to experience homelessness, we have to continue to do more and better to address their needs and serve them in a culturally aware way, and make sure that agencies that are by and for those populations are serving them or having an important seat at the table in order to increase the cultural awareness of those particular populations. Next slide. So a couple more data points. Throughout 2020, we had about 1,900 households that sought emergency shelter. So this means that they called the Housing Solution Center or worked with an outreach team and said, yep, I'm interested in getting into some type of shelter. And in 2020, a very impressive percentage of people were able to access shelter at some point during that time period. And that really can be attributed because of COVID. and that we as a community were able to greatly increase the number of people staying in motels, that our shelters were able to increase the number of people that they were serving, as well as stay open longer or create new spaces for people who needed to be sheltered. Most notably, the county had opened up the Motel 6 for quarantine and isolation, as well as expanded shelter. And that served over 500 people throughout those 6 months. And then we also know that the Council for the Homeless provided enormous, over 1,000 people with motel vouchers as they sought to stay safe from COVID. And enormous kudos to all the shelters for just remaining open and continuing to serve people very well, because we know in other communities that didn't happen. Shelters had to close, and we were really fortunate that that didn't happen, and that more actually remained open in our community. Next slide. So this is a picture of the housing programs. And when I say that, I mean transitional housing, rapid rehousing, and permanent supported housing. And these are all programs that help people move into long-term or permanent housing situations. These folks are moved from homelessness into those housing situations. So throughout 2020, we had nearly 3,000 households that said, yes, I'm interested in additional support to get into a long-term housing situation. And among those folks, about 500 households were able to get into a housing program. That's about 16% of the need. And so what this says to us is that we need more housing supports. And this can look like any of those three types of housing. It can also look like creating more affordable housing opportunities, as well as additional supports for people to be able to remain stable in their housing. I will say that 478 households that were served through housing programs is almost 100 more housing spots than we had in 2019. So we're going in the right direction as a community. We just have a long way to go. Next slide. And then lastly, rent assistance. This was sky high in 2020. We know that because of COVID, folks had a very hard time being able to pay their rent due to unemployment, due to increased costs, due to barriers to being able to meet their basic needs. And so as a community, we were able to provide nearly 2,300 households with rent assistance, which is incredible if we compare to 2019, where it was only about 250 households. Next slide. So here we ask our folks who call in who are experiencing homelessness what their last permanent zip code was. And when we hear from them, we mark that down, and it allows us to be able to have a better understanding of where people are coming from if they're experiencing homelessness. So if we think about what percentage of people are from Clark County, any ideas? So this one is D, 76%. A very high percentage of people are identifying zip codes that they previously lived at in Clark County. And that's not a surprise. This is something that's consistent year over year. Next slide. So here's a picture of the Clark County map, and it shows the number of people that identified a zip code within that area. So for example, on the far bottom left, 249 is for Fruit Valley. And that middle area with the highest percentage, that is where the former navigation center was, where Rose Village is, as well as St. John's, and the Fourth Plain corridor. And we know that that area is partially a prominently lower income area, especially as you go further north. I'll also point out that about 66% of folks were from the city of Vancouver. And so what this tells us is that we're not seeing an enormous number of people come from outside of our community. And that often is a myth that we hear, but it's just not a reality for Clark County. Next slide. So another question we ask is the reason for homelessness. We allow people to just share their reason. We don't give them kind of an A, B, and C option unless they ask for it. And then from what they share, our staff identifies, okay, do you feel like eviction would be your reason for homelessness, for example? And so with this information, we had responses from about 75% of the nearly 4,000 households that were served. And prominently, you can see that folks are identifying affordable housing or lack thereof as their reason for homelessness. And secondly, domestic violence. And that makes a lot of sense, especially if we think about COVID being the prominent factor in 2020. That overall, as a community, we saw domestic violence rise significantly. And then household crisis, which of course encompasses many things, came in third. Next slide. All right.
All right,
Thank you.
I'm gonna take it back over. Thank you so much for that data, Kate. So now we'd love for our panelists to join in tonight. I'd like for us to hear from them. So they're here basically to provide some context for the data that you've heard about and to bring some of that to life through sharing their experiences as service providers in our community. So first up, we have Heather Wilkins from Janus Youth. Heather, can you share with us some of what you've seen throughout this past year as it relates to youth experiencing homelessness?
Yes, this past year has been pretty difficult on all of us, but it's also kind of hard to figure out what's been going on. So it's impacted. We still are doing outreach. We do street outreach all throughout Clark County, but we try to connect with places where youth are regularly hanging out, and with all of the shutdowns that were happening and the things that were closing down, and it was harder to connect with youth. In the past, we've done a lot of outreach like at some school programs, and that wasn't accessible. And also just some of the places where youth would congregate in larger numbers and we can make those connections, they're discouraged from doing that. So it's been kind of an interesting thing to try and figure out where the youth are. And so we still we go to camps and stuff like that. But historically, a lot of youth, like we would just go and connect with them where they're hanging out and start to build that rapport and that trust. And as youth get to know us, they might refer a friend or start to build that safety and say, hey, that actually is my situation. And we'd start working with them that way. So just COVID in general has become a barrier in how we're doing outreach, but we're still out there doing the best we can and connecting people with basic needs supplies and connecting people with resources and referring people to the Perch, our drop-in center, as much as we can. And we've been able to keep that open. It has had to be quite a bit different because of COVID. We've had to limit how many people can access the space at one time. It's kind of a small space, so we really had to be conscious of how people can like physical distance and stay safe with that. But we've been able to navigate it in a way where like the services haven't been affected. So people can still come and do laundry and take a shower and get their mail there and work on computer or take a nap. So that's been really great that we've been able to maintain that. And let's see, I know also we have some housing case managers with Janus Housing Programs. I oversee the outreach programs and the drop-in center, so that's not my solid area of expertise, but I can speak to it. I know they've been doing an amazing job just trying to continue to connect with youth online and over the phone, and done a lot of eviction prevention work for youth. And I think that's really impacted the numbers that we're seeing of not a real significant increase, especially for that 18 to 24 age range, because our Janus programs works with youth under the age of 25. Yeah, so COVID has really significantly affected that. In general, the Perch has just been kind of their safe space that they get to hang out the whole day if they'd want to, but we're not able to do that. But we have been able to maintain like a really regular supportive connection with a lot of youth who are still out there. And we also have a supply table. This is a new thing that we started doing during COVID. We have a supply table that we keep out on the porch, and we communicate that to anyone we see on outreach. Sometimes when we go on outreach, we're seeing more older folks than youth. So we still supply those basic needs supplies that we have, and let them know that we have a supply table too. So if they're downtown, they're welcome to get anything from there. I'm just trying to meet that need of things that people, need to stay safe, like masks and water and hand sanitizer and a little bit of food, socks, stuff like that. So yeah, I'm not sure where I'm at time, Laura.
Great. No, thank you so much. I think that the adjustments that you had to make, for COVID and just the challenges of finding folks, probably, align with that data that Kate was sharing around, that the number of unsheltered youth really didn't go up a lot this last year.
Yeah.
So,
we are seeing the ones that we still have a real regular connection with are really, really disenfranchised from other services. So I'm really glad that we've been able to keep that going basically the whole time with COVID. And one thing that we did, we kind of rearranged our whole space. If anyone here has been to the space, you may not recognize it, but one room we opened up to if there's students that are experiencing homelessness, whether that's couch surfing, staying in shelter or anything like that, but don't have access to do online school, that room can be just for that. We haven't had a whole lot of usage with that. We've, I think a lot of our students are just struggling with school, but we've had a lot of youth use it for connecting with assessment appointments, counselors appointments and stuff like that. So we're doing our best to think outside the box and just meet the needs that are out there.
Yeah, wonderful. All right, thank you so much, Heather. Next, I want to turn it over to Katie Lewis with SHARE. SHARE provides much of the emergency shelter in our community through shelter for single men, families with children, and single women. And this last year, they also added on staffing to their role in the community of the WHO shelter at St. Andrew Lutheran Church due to COVID. So Katie, can you share with us some of your experience just with all of that emergency shelter providing that you all were doing at SHARE this last year?
Absolutely. Thank you for having me here. I could probably talk about this for hours, but I'll try to keep it brief. I was the program director of Share House and oversaw the WHO program at St. Andrew as well throughout this entire, up until recently. So when COVID hit, we obviously had to, change our approach pretty quickly. All of our shelters are communal. They all have communal spaces. We are vulnerability based for referral. So a lot, the majority of our people that we serve are, very vulnerable and fell into that extremely vulnerable category. We were able to extend our, usually the WHO at St. Andrew, who serves Single women, couples, and families only run from November 1st through March 31st, but we extended that in the beginning of 2020 through June. And then at Share House, we didn't have to, we stayed at capacity, at what our capacity was. And then at the family shelters, and it kind of hit at the same time, we were renovating those spaces. So we actually lost family shelter space and had to do a lot of maneuvering and depend on the community to really help us, support us during that time. And so it really makes me think about where we might be one of the biggest providers for emergency shelter in the space. It really highlighted and really spoke to the community that we live in, and just an amazing, outpouring of support and collaboration to be able to serve more people, provide more emergency shelter beds in our community than ever. At Share House, we were able to, in the beginning, work with the Council for the Homeless to be able to place 10 of our most vulnerable, most likely to get COVID and or pass from COVID, into the Q&I motel. And that was absolutely wonderful. And then we actually had an outbreak in December. We were able to keep everybody safe. We did some things like, we had each dorm become a pod. We put TVs in the rooms. We delivered food to them. We really encouraged them to, physically distance as much as they could in the space, wear masks. And I can't tell you how impressed I was by, our friends in shelter that were so willing to take care of each other. And as annoying as it is to wear a mask in the place where you live, they did it. And they did it willingly. We opened up kind of a, if anybody drives by Share House, that there's, we have lots of neighbors that live outside. And there was a real concern around providing a place for them to go to the bathroom, a place for them to wash their hands, and, stay safe and healthy. And so we opened up kind of a quasi outreach, and we had a person that was able to keep our bathrooms open for extended periods of times so that people could access those, and really work with the people outside to help, connect them with resources if they needed to. If they were sick, get them referred to the quarantine isolation motel, and that sort of thing. In December, Share House had an outbreak, and we were really happy to be able to keep people safe for as long as we did. And about 50% of the clients and 50% of the staff tested positive. But it was, and that was about the time the quarantine isolation motel actually had closed. But there were dollars to be able to help people move into motels. So we moved people along with the Council for the Homeless into motels so that people could quarantine isolate and get better in a space that was not in a community space, and then come back when they were safe to come back. But if we didn't collaborate with the council, with even the Radio Cab did all of our transportations, which was amazing. They had really awesome protocols, and they had no problem helping our guys and clients get back and forth to get COVID testing, to get to the motels. Peace Health was an amazing collaborator as well. Any of our clients, since we serve, a lot of our clients are seniors and medically fragile. Anytime one of our clients had to go to the hospital, they would test them before they sent them back, so that we knew. And if they were positive, they would keep them and get them referred over to into a motel. We had to collaborate with the county public health to learn how to contact trace, and they were amazingly helpful. Tower Mall for testing, just a huge, so many providers had to help support us during that time, and that was amazing. But we were able to stay open, and then so now we have both of our family shelters are open. There's less people. They're not completely to capacity yet, but they are open. We were able to open St. Andrew again in November, with of course a lot of new things in place from when we closed it down. We got to reimagine the space. We didn't get to serve as many people as we normally would, but we were able to do things like put barriers between sleeping areas. Before, we used to like not even let a couple sleep next to each other. We'd have a chair in between them because God, but now families were able to sleep right next to each other. Couples were able to sleep right next to each other, but be able to maintain physical distance and safety. And that was really nice. One of the big things that we did get to do, although we may not have served as many emergency shelter placements as we could have, we served a whole bunch of meals. We did have to shut down our dining room for indoor dining, but that allowed us to be able to create tons and tons and tons of to-go meals. We provided, to put it in perspective, in 2019, we served about 44,000 meals. And in 2020, we served 92,000 meals. So tons of volunteers, tons of employees, just making meals and delivering them all over. So we were delivering meals to people that were sheltered out in motels in St. Helens, which was quite the drive. Ridgefield, all over the place. But it was really nice to be able to collaborate and give and do what we could in the community as well. I don't know where I'm at on time, Laura.
Yeah, thank you so much. That's really great. And I think it does speak to just, some of that extra funding that came in and the different ways in which we could provide shelter that, we hadn't necessarily been able to do before, which I think all contributes to the numbers that Kate was sharing around, just that extremely high amount of emergency shelter capacity that we had, despite the fact that in some ways it was lowered because of physical distancing and COVID. Overall, it increased because we had all these other innovative ways of doing it, from expanding WHO season at St. Andrew to the Q&I to all of it. It all fits together. So thank you for that. All right, now I would like to introduce Jennifer Klein and Patrick Quinlan from Outsiders Inn. Outsiders Inn is one of our wonderful partners. They provided staffing for the St. Paul WHO shelter for single men, as well as all of our emergency severe weather overflow shelters at some different churches around. So that includes River City Church, Beautiful Savior Lutheran Church, and Emmanuel Lutheran Church. So they actually helped staff those shelters because typically those churches relied on volunteers to staff their shelter during the winter. And to be clear, those churches open up on the nights where we call severe weather, which is when it gets below 32 degrees or there's snow or ice in the forecast. And so basically, these churches were able to continue to open up and operate. And in fact, between the three of them, were able to be open 7 nights a week, which was phenomenal. In addition to then also expanded 24/7 shelter at the WHO St. Paul. So Jennifer and Patrick, thank you so much for all of your work and for being here tonight. And how did you guys operate things differently in 2020 once COVID hit?
Well, we had to obviously make quite a number of changes. Obviously, limiting occupancy was one of the first things at St. Paul's and the severe weather shelters. Spacing out the beds accordingly, providing room dividers where we could. At the severe weather shelters, we actually set up cubicles and pipe and drape and curtains, and divided up the rooms into different cubicles so people could have privacy and reduce the chance of transmission. We had to change how we were doing meals, all instead of buffet style or volunteers coming in and providing the meals. We had to alter that and you either box it up or individually plate them, pre-prep the meals and have our staff deal with it instead of the volunteers that were that had been helping or that coordinated the meals. It took a lot of cooperation and luckily the staffs at the churches had already been through previous years and helped obviously the transition quite a bit. I know that the daily screenings for COVID and sanitation and cleanliness was all improved. And we, one of the big things was just cutting back on social hours and the social time that the residents would congregate. Obviously, we were discouraging that, and actually it wasn't really a problem. Most of the guests kind of isolated themselves and stayed away. So that's kind of where we were at, the big changes that we had to do.
Yeah. And can you tell us a little bit about the efforts at Living Hope Church with the encampment during 2020?
Sure. Yeah. In the very beginning, I think it was April, we got a call from the council in the city to open up a camp next to Living Hope Church. And we were able to, I think we grew to 24 spots that were I think we ran about 95% occupancy. We were pretty full every night. And Kate, I'm not sure of the totals, but I think it was about 325 or so individuals that we saw come through the campsite. And again, that was kind of emergency sheltering. We provided as much service as we could. Kind of like Share House, a ton of meals on a zero budget and unexpected. So yeah, we did a lot of what we could do as far as providing the emergency needs. The efforts that I think the shelters this winter in St. Paul's, we were able to provide a little more enhanced services and better case management, just because it was inside and fewer numbers.
Great. And Jennifer, what would you say was the general mood and experience by the guests this last winter season? And maybe share what surprised you the most through your experience providing shelter, especially in such a crazy year like 2020 and 2021.
I can share my experience on the mood and stuff for 2021 season. I unfortunately was not part of last year's season. However, I did talk to another person that was. The mood between then and now was a whole lot different, because back in last year they could have socialized. They didn't have to stay in this little cubicle. I call them their holes, but they didn't have to stay away from each other. They could have played cards, games. They could have talked. And this year, from what I've seen at the two churches, the Beautiful Savior and Emmanuel, they all went to sleep around 8:30 because there wasn't anything for them to do. So I would think the mood would be like somber, more so at the beginning of when the shelter started, because people were so worried that it was going to get spread even more. They were really strict. They had to go to pick up their meal and their box meal one at a time. They couldn't even be at the table together. But towards the end, I would think it got a little bit more personable. We got to talk to them a little bit more because things were a little bit more lax. They weren't, because it was the same people almost every single night, besides a few stragglers that would come in for 1 or 2 nights. It was mainly about 8 to 10 people that were there every single night. And so they knew that they weren't contagious or anything. So they got to socialize through their curtains. And they would stay in their own cubicles, but they would actually start talking to other people or even come and talk to us at times.
Great. Was there anything that you learned operating this year that we could carry over into future years for, to make things even better for our guests?
If COVID wasn't around, I think it would, the way we ran it this year, it should be ran the same way, not necessarily with the temperature checks, but with having individual spots that even families or couples could stay in, because as I understand from before, it was just mats all around the floors, all over the building, and there was no privacy. Well, at least this year they had the privacy. So I think that should continue. With COVID, that there was only allowed 15 couples or single women or whatever they were. At Emmanuel, I do know that the pastor was really persistent on wanting couples, but there weren't any couples that had called in to get shelter. It was mainly single women and a few men.
I think the other thing also is to provide additional services other than just a place to sleep and a warm meal, whether it's bus passes. River City, we were fortunate enough to have a shower available. Providing some laundry passes occasionally for people to get their laundry cleaned up. Getting them connected or assisting with resumes or getting them connected with some social services that they may need. I think we were trying to do more of that this year and would encourage that to continue. I think one of the downfalls or one of the frustrations of the residents was just the mobility factor of having to go from shelter to shelter and then one night at River City and then back on the routine. But they were also very grateful for the blessings that they were receiving. So ideally we would, maybe regionally keep that more limited or just 2 locations. But again, they were blessed to have it, and we're grateful that all the cooperation between all the churches and the council pulled this last season together. It's really quite astounding, the numbers that we saw and the number of people that we've been able to help thanks to the team, everybody on the call.
Yeah,
One of the things
we're very grateful.
about, I was surprised at the numbers because because they were the same people over and over again. It didn't seem like it was that amount of people that we actually did serve. But
we did
it's
almost 100 through the severe shelters or severe weather. So
yeah, absolutely. Well, we appreciate Outsiders In tremendously, and thank you both for sharing about your experiences there. Now we'd like to spend a few minutes on some Q&A. So let me check our chat here. I think Diane asked about people moving in or out of the area, and hopefully that question got answered when Kate was talking about the zip code data and just, how 76% of people experiencing homelessness are from Washington State or from Clark County actually, and 66% are from the city of Vancouver originally before they became homeless. So if that's what you were asking, hopefully that answers your question. Let me know if you need if I misinterpreted that. I see another question around the school districts, if they're stepping up to address homelessness among students, offering overnight parking and showers for students and families. Does anyone have any insight on that?
I can share that specifically those things are not happening. We have a number of overnight parking opportunities at local churches, as well as the Evergreen Park and Ride. The options don't move into the Vancouver Evergreen School Districts. I will say that there are a number of different programs that specifically serve families in those school districts who are experiencing homelessness, whether it's rent assistance or it's rehousing of folks that are experiencing homelessness. So while the school district isn't specifically, providing money to families, there are programs that are to help them stay housed or to help them move out of the car, off the street, into housing. And I'll say the Council for the Homeless has one of those programs. It's called the Homeless Student Stability Program, and it was just funded for another year in the amount of $400,000. So we're thrilled to be able to work with those 2 school districts specifically again for another year. I also see the question regarding the rental assistance being sustainable versus ongoing or one-time funding. The majority of the rent assistance that exists right now is one-time funding
Yeah.
that's being provided for households that are either in arrears, and for some of the programs that could be up to 12 months of arrears. And believe it or not, we're seeing it, unfortunately, due to the effects of COVID. And there's also opportunities for households to get assistance with future months, potentially up to 3 moving forward. I will say that there's a bill in the Senate right now that proposes additional document recording fees that would support ongoing rent assistance, which we know is going to be incredibly needed, particularly when the eviction moratorium ends. So that bill is House Bill 1277. Is that right, Laura?
Yes.
Yeah, 1277 House Bill, and it's on the Senate floor right now. And there's an opportunity to advocate to move it out of the Senate with a passing vote. So please feel free to contact your senator if you feel like additional rent assistance moving forward will be needed. Thanks.
All right. Yeah, thank you, Kate, for mentioning that. All right, Kate, we're beginning the conclusion of our webinar tonight, but we do want to share some upcoming shelter and housing projects for people. Kate, do you want to talk a little bit more about this?
Sure. I just want to make sure that folks know that as a community, there are many things that continue to be developed to help address homelessness, as well as the challenges related to affordable housing. A few to celebrate include that the Elwood, which is a permanent supported housing complex for people with behavioral health challenges who are exiting homelessness, just opened the beginning of this month. And we were able to move in a significant number of people who otherwise would be unhoused. So really excited about that. We also know that Community Roots Collaborative is creating cottage homes out in Fruit Valley for people exiting homelessness. And that's a project that has been in development for a very long time. That Lifeline is creating a recovery home for moms. Peace Health is creating family housing for both families and individuals over by the hospital. And there is a shelter that is being developed over in the former Howard Johnson's that will be run by Catholic Charities of Western Washington. And it will serve a myriad of populations of people who are currently without a home at this point. It's slated to open in September, and the access will be through the coordinated entry here in Clark County. So a lot of positive things in the works, and there's even more with each funding source that comes through. And our eyes right now are on the American Rescue Plan, which is the last COVID bill from the feds, because we know that more money will be flowing down from the state, from the county, from the city, to be able to support immediate needs of people experiencing homelessness, as well as the longer term needs to help them move out of homelessness.
Great. One last question before we wrap things up. Do we have an idea about the number of people currently living unsheltered in Clark County?
So we certainly do. I think that this 2020 number is a good start. And then we have HMIS data, which can be pulled for really any point in time to understand how many people are without a home. As well as we actually have by name lists now, which help us track the number of people within certain populations that are experiencing homelessness. So for example, there's a by name list for people who are chronically homeless. And on that list, the number was around, I think 250 individuals that were experiencing chronic homelessness within the last month. So yes and no, just depends on the time period that we're looking at.
Great. All right, I know we're getting close to 6:30, so as always, we'd like to leave you tonight with a call to action. Tonight, I actually have two types of calls to action. One starting with our homeless crisis response system providers, our funders, and our lawmakers. We ask that all publicly funded programs that support people moving out of homelessness should be entering data into HMIS. That helps us get these accurate numbers. In order to track the overall system outcomes and program successes, we need to continue to invest and partner with groups and agencies that are by and for BIPOC community members. Kate mentioned that earlier tonight. Those by and for groups and agencies are operated by members of a community for the members of their community. We need to invest in housing and homelessness programs that are specifically for the BIPOC community and that are shown to have strong outcomes for BIPOC households. You saw earlier tonight just how disproportionately impacted by homelessness and poverty BIPOC households are in Clark County. We need to increase permanent supportive housing options in Clark County that are affordable for those who are 30% of the median income. This includes further diversifying housing options, including small homes, duplexes, triplexes, quadplexes, studios, utilization of motels, which you heard we did a lot of in the last year, ADUs. We need to increase funding for supportive services that assist people in remaining housed, which we did a lot of in this last year. We need to increase the number of housing-focused street outreach staff in the community, particularly those who work non-traditional work hours. Outreach staff are like Heather that you've heard from tonight. They're professionals trained to connect people who are unhoused to resources. And we need to increase capacity for non-law enforcement staff to address the needs of people in mental health crises in our community. This includes mobile 24/7 peer crisis counselors, mental health practitioners, and physical health providers, including a prescriber. And finally, increasing safe and affordable childcare resources, especially for parents who work non-traditional hours and need drop-off respite support and rely on public transportation. And for our community tonight, as always, I would first like to ask, there is a survey to fill out. I added a new feature and learned how to do surveys. So there'll be a survey sent out to our attendees tonight. So please do fill that out and let us know how we're doing with these webinars. It's been about a year now that we've been doing this. You can sign up for our monthly e-newsletters. You can be a housing and homeless advocate. You can share this data that you've learned tonight. It's on our website. You can dispel myths, reduce stigma, be kind, and stay tuned. There'll be more webinars every month throughout this next year. We will see you again in May, and I do want to thank you all for being with us tonight, and thank you so much to our panelists. We really appreciate all of you and the work that you do and for being here tonight with us. So thanks everyone, have a wonderful evening, and we will see you next month.